Drug addiction is a disease. We often use this phrase in society. However, we don't treat drug addiction like we treat most diseases. It's too complex, different drugs act in the brain differently, and then there's the societal stigmas against those addicted. However, in order to truly treat drug addiction like a disease, we must first take the trouble to understand it, specifically its neural implications. The dopamine D2 receptor is an inhibitory protein. This means that it senses when dopamine levels in the brain are rising, and then it sends signals to reduce them. Previous extensive research has shown that low D2 receptors in the striatum is related to a higher vulnerability to drug addiction. However, not as much research has been performed about addiction and the role of D2 receptors in other areas of the brain, such as the hippocampus, which is a center of learning and memory. The D2 receptors in the hippocampus play an essential role in synaptic plasticity, which is the ability of a brain to change the strength of its synapses over time. Our goal in this project is to understand the relationship between D2 receptors in the hippocampus and PCP-induced impairment of the hippocampus. We will do so by assessing the working memory of two genotypes of mice upon administration of PCP. The wild-type mice that have the D2 receptor present in all areas of the brain, and the D2R knockout mice in which D2 receptor is absent. Our hypothesis is that the D2 receptor knockout mice will show a dampened response to PCP because they simply lack those plasticity-inducing D2 receptors in the hippocampus of their brain. In order to assess the working memory of the two genotypes of mice, we will be using a Y-maze experiment. On day 1, we inject the mice with either PCP if they're in the drug group or saline if they're in the control group. And on day 2, we place the mice in this Y-maze where they're allowed to roam freely for 10 minutes. As you can see from the diagram, we are looking for the mice to rotate spontaneously through the 3 arms of the Y-maze, which is a show of higher cognitive ability. The results show a striking difference between the wild type and the D2R knockout mice. As you can see, the D2R knockout mice show no significant change in working memory upon administration of PCP, whereas the wild-type mice show a significant decrease in working memory upon administration of PCP. This shows that D2 receptors are essential for PCP to alter the working memory in mice. The D2 receptor exists in 2 forms, a long form and a short form. In the future, I would like to repeat this experiment with the D2 long knockout mice and the D2 short knockout mice to truly understand which form plays a bigger role in inducing neuroplasticity in the hippocampus. I would like to thank my PI, Dr. Emiliana Borelli, my supervisor, Laura Natsuka, and all my respective lab mates for their guidance and help. A treatment for substance abuse is still a puzzle to mankind. However, I am both grateful and proud that I'm able to add a small but invaluable puzzle piece. Thank you.